Considerations and engagement with stakeholders are being pursued on options to convert the current COVID-19 levy, which is currently applied to our goods and services, into a national health security or emergency fund, such that if this materializes and the ring fencing is done, an amount could be determined to complement the NHIS contribution to reduce or at least totally address the vaccine financing gap. It is in this light that the service is very glad and support efforts by Hope for Future Generations and its allies with the vision to embark on this financial immunization advocacy response project. The country has been able to eliminate neonatal tetanus since 2011. We have not received any report of wild poliovirus in Ghana since 2008. And there has not been any documented death in Ghana between 2003 and 2021 that is attributed to measles. The cases of pneumonia and diarrhea diseases in children has drastically reduced, and no case of meningitis due to Neisseria meningitidis type A have been reported since 2012 in the country. And all these are attributed to the significant works that we are actually deploying by way of the vaccines that we are giving to the population. Vaccination has helped improve the life expectancy of the population in Ghana, with no doubt. It has been the best investment that any government could ever make. It has contributed to the reduction of under 5 mortality from 111 per 1,000 live births in 2003 to 40 per 1,000 live births in 2022. Infant mortality has reduced from 64 to 28 per live birth, and neonatal mortality from 43 to 17 per 1,000 live births within the same period. The EPI program is without challenges, prominent among them being the vaccine shortages that we occasionally do encounter. And all this boils down to the financing of immunization program in Ghana. And I must say that the financing of immunization in Ghana has been an area that the government has supported over the years. The government has paid almost a third of the cost of vaccines in the last 5 years, with an increase of its share since 2019. Immunization in Ghana is heavily supported by partners. And currently, Gavi, the Vaccine Alliance, supports approximately 70 to 80% of the cost of vaccines and their delivery in the country, including health system strengthening. And as we are aware, the country has entered the accelerated transition to the Gavi support that we are enjoying. And it is expected that by 2030, we should be able to fully finance our vaccine requirement as a country. In this regard, a transition roadmap towards the self-financing of immunization in Ghana has been developed by the Ministry of Health with the support of partners to ensure that enhanced and sustained access to vaccines and vaccination program is ensured. And how these can be managed and fully financed from 2030 onwards has been documented. This transition roadmap provides a guide to the gradual and progressive shift from donor financing towards domestically funded immunization services that will include ensuring vaccine supply and deployment and strengthening the health systems are guaranteed. And I'm very sure that the launch of the FAIR project will then fit in very well with this particular roadmap that has been drawn.